right, it's 3 o'clock. I'm going to go ahead and get started. Alrighty, everyone. Well, welcome to the second webinar in our series on health literacy and chronic disease. My name is Anna Shao, and I'm the program coordinator at the Horowitz Center for Health Literacy. So as Catherine mentioned, there are some housekeeping items. If you haven't already, please go ahead and complete the pre-webinar survey at the link below. That also goes for folks who are watching this recording after the live event. After the webinar, you can request the slides at this link. And as an attendee, you're automatically muted when you come in, but you're more than welcome to ask your questions. Just go ahead and type them in the Q&A box. Catherine will be monitoring that box, and I will stop every so often to check in and ask what questions you all have. And if you're having any trouble with the audio, you can call into the webinar at this phone number and access code. All right, so again, thank you so much for taking part of this webinar. This webinar is one of 6 created by the Horowitz Center for Health Literacy at the University of Maryland's School of Public Health in partnership with the Maryland Department of Health. And so this webinar training is part of a set on health literacy and chronic disease. If you want to access the other webinar trainings, you can go to this link and sign up for the remaining 4 that we have. You can also go to that link to look for the recordings that we have of last week's as well as this week's, once that's final. So today we're going to focus on written communication. How do you create health information that people will want to read? So let's start by talking about why clear communication matters. If you're part of a health department, you've probably heard of the standards from the Public Health Accreditation Board, or FAB. In standards number 3, 7, and 8, there are elements of health literacy and clear communication. So clear communication is baked even into the accreditation process. In addition, the Maryland Diabetes Action Plan includes goals for maintaining healthy weight, knowing your pre-diabetes status, reducing diabetes mortality. All of these goals require communication, education, and health literacy to achieve them. So again, very important that clear communication is in all of the aspects related to diabetes prevention and management. Also, Maryland's primary care program has quality improvement objectives that line up really nicely with health literacy and clear communication. And even as you think about the communities that you serve and that we all serve, surely there's been a time when you weren't 100% sure that your message came across clearly. We should strive for clear communication so our communities and audiences can understand our messages and take actions to live healthier lives. And as we all know, chronic disease is quite complex. And so if you're clear, it helps with the complexity. So back on chronic diseases, we expect people with chronic disease to follow instructions, and sometimes it can be hard for us to give them information and tools to make sure that they know what they need to do to take care of themselves. So for example, if a person has to take lots of different medicines in different amounts at different times of the day, what resources have we given to those folks to make sure that they can follow this complex schedule? So again, written communication can be complex, chronic disease is complex, but we can definitely work to untangle this complexity and make things clearer for folks that we're serving. So clear communication is also a core component of health literacy. Our center uses the National Action Plan to improve health literacy as a guide for our work. In fact, the underlying theme and message in the National Action Plan is that health information should be these 3 things. Health information should be accurate, it should be accessible, and it should be actionable. Our view, based on the action plan, is that health literacy occurs and flourishes in a community setting with effort from all of these sectors that you see in these hexagons here. All of these sectors come together to build a health literate community and society. I suspect today on this webinar we have folks from several of these sectors. We probably have folks from the health information creator and distributors. We have folks probably from healthcare, folks from community services, faith, social, and information services. And when we all work together with healthcare, with education, with government agencies, with researchers and implementers, if we all work together to create an environment where health information is, as we said in the last slide, accurate, accessible, and actionable, we have a health literate community. So this is pretty exciting. Yesterday, Healthy People 2030 just launched all of their new goals and objectives for the next decade. And they released an updated definition of health literacy, dividing it into two parts. There's personal health literacy, and then there's organizational health literacy. And so personal health literacy is the degree to which individuals can find, understand, and use information and services to inform health-related decisions and actions for themselves and others. On the other hand, we have organizational health literacy, which Healthy People 2030 defines as the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And so this new updated definition incorporates a public health perspective and acknowledges that organizations and our work in them have a responsibility to address health literacy. So instead of focusing on the individual and their ability, we widen the lens and we look at it also from an organizational perspective and put some responsibility on the organization to provide clear information. Right, so now that we've talked a little bit about health literacy, let's go into what I hope you'll learn from this webinar today. By the end of this webinar, you should be able to evaluate when to use written materials to communicate with your audience, explain why written materials can be challenging, describe 5 strategies for creating effective written materials, and then describe 2 tools for creating effective written materials. So as an overview of what we'll talk about today, first we'll talk about how to decide when to use written materials. Then we'll talk through what effective written communication is and why it's important. We'll focus a decent amount of time on the process and strategies for creating effective written communication. We'll discuss reading levels. That comes up quite a lot when we're talking about written communication. And then we'll wrap up with talking about dissemination of your materials. And we'll also talk about next steps and resources. So let's start by talking about how to decide when to use written materials. So when you need to communicate some important health information, you have a choice. Do you deliver it in a written format, like physical flyers or fact sheets or brochures? Or do you do it in an oral format, whether two-way, like face-to-face, or virtual, like we have been doing a lot of these days, or one-way, like a video or audio recording? So let's go over some reasons to use written communication. In next week's webinar on oral communication, my colleague Catherine will discuss some reasons to use oral communication. I will gloss over it here in this presentation with a specific focus on reasons for using written communication. So there are plenty of reasons why you might consider using written information over oral information, written over oral, excuse me. So first, your audience, maybe they need to go back to the information later to follow a set of directions, and a physical brochure or flyer can help them do that. Next, maybe your audience is distracted or has other priorities during the time that you're trying to reach them or in the middle of an appointment. So in that case, written materials can help them digest the information when they're less distracted and when they have more time. And it can also reinforce whatever they heard in the moment, and it can fill in the gaps if they weren't able to hear or were distracted and couldn't hear what you were saying in the interaction. Next, maybe your audience is in the beginning stage of learning about the topic, so they have very little prior experience. So your written information can provide some background information that can be useful and help them understand. So the material can help them learn about causes and sources and related issues. Maybe it's not super important knowledge, but necessary for immediate actions, but not necessary, excuse me, for immediate actions. And finally, written communication is good for visual aids. That can include charts, images, photos, drawings, tables, and a lot of people do learn better visually and need visual aids to fully understand some concepts. So again, that can provide some additional information to your written communications. So in terms of using this, what I call two-way communication, this face-to-face or telehealth or virtual, here are some reasons that you might want to use that format. Maybe the audience has weak reading skills, and listening and talking back and forth would be much more helpful for ensuring comprehension. In this two-way conversation, you can also do nonverbal reinforcements, which is, again, a way to make sure that the person you're engaging with understands what you're saying, and you can kind of read their body language. You can also use this two-way communication to demonstrate an action, and you can make sure that they understand what you're doing and what they need to do on their own to take care of their health. And maybe you have to have a dialogue. Maybe you need to make a decision together. And so that face-to-face or telehealth communication is a great way to do that. And so in terms of choosing oral communication where it's one way, so maybe it's an audio recording like a radio ad or a PSA, or a visual communication like a video. Some reasons that you may want to do that: maybe you need to give some follow-up education after a diagnosis, and so you're not overwhelming your listener with a bunch of information at the forefront, and they can just follow up with that information later. You can also teach some self-care skills through this format, and your audience can go back to this recording several times and on demand. And when you're doing recorded audio or video, you can also use the power of human voice and the human face. Excuse me. And so that really emphasizes, storytelling can be a really effective way to get through to folks. And with audio or video recordings, you can break down complex actions into sections. And again, that goes to the point of breaking things up into easy to understand pieces, and your audience can go back and watch it as many times or listen to it as many times as they want to. So I'm going to pause there now that we've talked about deciding between written and oral communication, and check in with Catherine to see what questions we may have.
Anna, we don't have any questions at this time.
Okay. So feel free, folks, to go ahead and chime in the Q&A box if you have any questions. But now we will go ahead and talk about the definition of effective written communication and why it's important. So written information can be quite a challenge. Some challenges, as you may see on this screen, is that there's a lot of words on the page. It can be cluttered. The text might be too small. It's really confusing and overwhelming. Or maybe it's not clear what I'm supposed to do after I read your material. It's hard to find the specific piece of information I'm looking for. Yeah, just overall, there's a lot of things that contribute to making written materials difficult. So how can we make it easy to read and understand? We'll definitely go into the process and strategies in just a few minutes. So there are two main components of effective written communication. The first one is that it helps your audience easily understand what they're reading. And sometimes we're casual about this concept of understanding. Maybe we say, I understand, even though we're not 100% sure, we haven't thought about the intent or the meaning of what we read or see or even hear. And so true understanding happens as a part of this communication process when the deliverer of the information and the receiver of the information have a match. And so when there's a match between those two audiences and those two parties, you have effective communication. Effective written communication also has some really important aspects. It's audience-minded. So when you're creating your information or your written materials, you're keeping your audience and their needs and maybe what they want to know in mind. And you're keeping in mind where they're coming from and their potential barriers and challenges that they might face. It also reinforces information that the audience may already have. Next, it can provide visual information to help readers process the information in a different way. And it helps to break up clutter and yes, it breaks down the wordiness of your document. It's a nice way to reinforce your main message. Your written material can also offer different levels of detail so that beginners can process the basic information and then later reread it for more detail later down the line. And one thing that we like to emphasize when we're helping folks create written materials is that your title and your headings, if someone were to only read those items, they should be able to catch the gist of what you're saying. And if they wanted more information, they could dig deeper into your text. And so again, that's the concept of what we refer to in the health literacy realm as a bite or a snack or a meal. So folks can choose whether they want only just the main gist, your main message, or they can engage a little more and have a snack and read your headings, or they can have the entire meal and read your entire page. And so if you create an effective written material, you set it up so that it's easy for your audience to decide how much they want to read and when. Written communication can also be an aid to memory. If you're handing out written communication after an oral conversation, that written communication can be a way to help folks remember what you talked about. And it's also a reference that they can use when they're not in your presence and maybe when they have more questions after the fact. The bottom line is that effective written communication can inform and activate the audience to take disease prevention and health promotion actions. And so if you are creating effective written communication, you're empowering your audience to go ahead and take steps for their health through disease prevention and health promotion. So we've talked about effective written communication and its importance. I'm going to stop here and check in with Catherine. Do we have any questions?
No, not at this time, Anna.
Okay. All right, so let's dive into the meat of this and talk about the process and strategies for creating effective written communication. So we've broken down the process of creating effective written materials into 3 stages. There's the stage before you write, there's while you write, and then there are strategies and processes for after you write. So let's start with what happens before you write. You want to define your audience, you'll want to limit your objectives, and you want to design the material so it's easy to read. So let's dive into all of those. So first and foremost is defining your audience. Who do you want to reach and what do you know about them? Some factors to consider about when you're thinking about your audience is Their demographics. Are they African American? Are they Hispanic? Are they Asian American? Things like that. And then another aspect you can consider is their lifestyle. Are you looking at smokers, non-smokers, folks who exercise a certain amount a day or a week? And that also plays in with health-related attitudes and behaviors. What are their thoughts around cancer screenings? What are their thoughts around laws around health? And you can also include prior experience as a factor. The more you can pinpoint who your audience is, the better, and the better you can tailor and write your communication for your audience. It's also important to know who your audience trusts for information. Where do they go for information? And that can inform your dissemination process down the line. It can also inform how you create your written material in the beginning. And we want to remind folks with this tip that you leave enough time in your timeline when you're developing these written materials to ask for feedback from your target audience. Make sure you build enough time to ask for that. And so you can really make sure that you're reaching them with the words that they use and that you are creating as much understanding as possible, making your message as clear as possible. Next, it's really important to limit your objectives. I know that it's very tempting, especially when we know a lot of information and want to pass it on to our audience, to just say, I want to tell them everything. But that can be really overwhelming for our audiences. So I highly encourage you to really think through, what do you want your audience to know or do after they read your material? So you'll want to keep the focus on one main message. And if it's action-oriented, that's really great. And that will increase the impact of your material. And when you're thinking of your objectives and the messages you want to build out from that, it's really important to put the most important information first in your material. It can be very tempting to give a lot of background first and then go into, oh, now that you know some background information, here's what you need to do. We highly recommend that you put the most important information first, and you can put the background information a little bit later in the material. And again, asking yourself that question, what do you want your audience to know or to do after they read your material? So for example, after reading the material, my audience members should know that they need to talk to their doctor about a diabetes test. Next, make sure that your material is easy to read. So this screenshot I pulled from the CDC's website on the description of diabetes and COVID-19. And I want to highlight some things on here that made this quick and easy to skim and scan. So first, there are useful headings. The first one is actions to take, and the next one is why you might be at higher risk. So maybe I'm coming in here as a person with diabetes, and I am not too interested in what actions I need to take, but I want to know why my diabetes puts me at a higher risk. I can skim and scan and find that heading and know exactly where I need to read. I don't have to read through all of the text to find what I'm looking for. Another great thing about this chunk of text here is that they've divided it into sections with bullets. There's chunks and there's bullets underneath. And finally, there's white space. That I know it's very tempting, again, to put a lot of information, as much as possible, for our audience members, but we do have to remember that that can be overwhelming. So incorporating a good amount of white space in your materials is very helpful and makes it easy to read. So again, we want to aim for content that's quick and easy to skim and scan and find what you're looking for. Especially because that's how most people read these days. We're not reading every single word. I know that even when I go on websites, if I can't find what I'm looking for within 10 to 15 seconds, I am pushing the back page and going to the next result to see if I can find it there. So let's move on to part 2 of creating effective written materials. So while you're writing, you'll want to use plain language, you'll want to explain medical terms, be careful with numbers, explain the risk, and choose appropriate visuals. So we talked quite a bit about using plain language in our first webinar, so I won't go into detail here. But the 3 main buckets of using plain language is first organizing to serve the audience, then choosing your words carefully, and then making information easy to find, which overlaps quite a bit with what we're talking about today. You are welcome to check out this resource from the Federal Plain Language Guidelines. They have a checklist for plain language that is very helpful. In terms of jargon or medical terms, when you're preparing written materials, it's important to explain what the medical terms mean. If you can't find a substitute, or the words or the phrases that you come up with are more difficult to understand, you can go ahead and use the medical terms. Just make sure you explain them. So for example, when you say you tested negative for diabetes, the jargon there is the word negative, especially because in our context, usually negative means it's a bad thing. So if I hear that I tested negative for diabetes, I'm thinking, oh no, I have diabetes. So the explanation here, or you could even consider saying, instead of that phrase, you could say, you don't have diabetes, and that's much more clear. And another example in the realm of chronic disease and diabetes, if you wanted to use the word fasting, you could explain it by saying fasting means that you haven't eaten food in the last 8 to 12 hours. Next, about numbers. When you're using numbers, make it as simple as possible. Avoid decimals and fractions and use round numbers that are easier to understand. So for example, while 5.2 million is much more precise, it's easier for our minds to comprehend and process if you just say about 5 million. Another example is that instead of writing 35%, you could say around 1/3 or about 1 in 3 to make it easier for your audience to understand. Do not require math from your audience members. So for example, here there's a BMI calculator on the CDC's website, and all you would have to do is know your height and your weight, and then the calculator does all of the math for you. So it's really important not to burden your audience members with doing that. And finally, it's important to explain what the numbers mean. So let's go ahead and look at an example of what it means to explain what the numbers mean. So for example here, if we're talking about blood sugar levels, for example, if this is what you're trying to explain to folks, if you have diabetes, your fasting blood sugar level should be 80-130 mg-dl. So in this statement, with the numbers 80 and 130 and the dash in the middle, there's potential that someone may not have the numeracy skills to know what the dash means. There's also the issue of this abbreviation of the mg-dl. So let's talk through that. The dash here implies that your audience understands the concept of range, and that the number they're looking for should be between the numbers 80 and 130. So you can further explain these numbers and symbols like this. This means that the number on your blood sugar device should be between 80 and 130. If it's 79 or lower, that means you're not at a normal level and you need to take action. So there you've explained the 79 or lower means that you're not at a normal level and you need to do something about it. Same for explaining if you're outside of the range. If it's 131 or higher, again, means you're not at a normal level and you need to take action. And finally, if you want to explain What that unit is, Ng/dl is short for milligrams per deciliter. It's a measurement that tells you how much of something, like sugar, is in your blood. Now, I acknowledge that this does add quite a bit of text to your material, and want to emphasize and encourage audience testing so you know what works and doesn't work with who you're trying to reach. Maybe it suffices that you just say that means the number on your blood sugar device should be 80 and 130, and if it's outside of those numbers, then you need to take some actions. Next, while you're writing your communication materials, it's really important to explain risk. Risk is a pretty complicated concept, so there's a lot we can do to make sure we're as clear as possible. If you're presenting information, including numbers about risk, it's important to explain what the risk means, the nature of the risk, as well as what will actually happen because of the risk. So let's look at an example. Diabetes, including type 1, type 2, and pregnancy diabetes, may put people at higher risk of severe illness from COVID-19. So to explain this, you could say, this means that if you have diabetes and get sick with COVID-19, you will have a worse experience than someone who does not have diabetes and gets sick with COVID-19. So you've explained the actual harm or threat by comparing it to someone who doesn't have diabetes. And then you've also talked about the nature of it, that you'll have a worse experience. It's also important, I know that when we talk about risk, we tend to include numbers in there. So if you're going to use numeric probability to describe risk, it's important to explain with words or a visual. So let's look at some examples. First, the natural frequency expression. So saying 1 in 4 is much easier to understand than saying a percentage like 25%. Also, it's important to remember, especially if you're presenting different risk levels, to use the same denominators so that it's easy for your audience to compare the numbers. So while it's easy for me to say, and since we've learned in school to reduce to the lowest fraction we can to say 1 in 3 and 1 in 4, it's actually much easier for our brains and our audience members to comprehend 4 in 12 and 3 in 12 and make that comparison and know automatically, oh yes, 4 in 12 is higher than 3 in 12. Whereas if you had said 1/3 and 1/4, you have to do a little bit of mental math to know that. It's also easier when you use absolute risk. So for example, 6% chance of a disease instead of relative risk where you're comparing it to another group or another phenomenon. So there you would write 50% less of a chance. That again requires quite a bit of mental gymnastics for our audience members and for ourselves. So as much as possible, use absolute risk to describe a risk. And I do want to note here for the denominators tip, it's okay to say 6 in 12 or 1/2. I think it's easier. It's also okay for us to make that comparison when it's denominators like that. So we've talked about explaining with words. Let's talk about explaining with a visual. Typically, you'll see an icon array with, for example, maybe 100 people or maybe 10 stick figures with a certain number shaded. So here we have the example, 1 in 2 women with pregnancy diabetes will develop type 2 diabetes. So here we have 2 stick figures, and one of them is colored in to show this, this risk, 1 in 2 women. And speaking of visuals, when you are writing up your materials, it's really important to choose appropriate visuals that match with your main message. And if you're talking about body parts, make sure that your visuals put the body part in context. So for example, in this first picture, you can see the body in the background with a box around the areas to focus. Then there's a zoomed in image of what that area is and a label of where the pancreas and the surrounding organs are. In contrast, this photo on the right doesn't help the audience understand the location of the pancreas in the body. You'd have to know that the red bent tube is a small intestine and that the vertical red and blue skinny tubes are blood vessels. But where in the body are we? So it's important, if you're talking about body parts, make sure you put it in context so that people know where in the body we're talking about. And in terms of matching your main message, for example here, the main message of sign up for a diabetes management program to learn how to take care of your diabetes matches this image here of folks in a diabetes class learning about food labels. All right, so now that we've talked about items and strategies to consider before you write and while you write, let's talk about what happens after we write. It's really important to, again, ask your audience for feedback and then revise your material according to that feedback. So asking for feedback, 5 people usually are enough to get a decent amount of feedback on one material. Do your best to find people similar to your intended audience and ask them to read your material and tell you what they think about it. Do your best to avoid asking your colleagues unless they're very similar to your intended audience. And you can also ask if you have access to a patient and family advisory council, you can ask those groups for feedback, especially if they match your intended audience. In terms of some questions that you can ask for feedback on with your written material, you can ask your audience to think out loud as they read your material. And that way you can understand what they're thinking while they're engaging with your material and maybe pick out some things that you'll need to revise as a result. You can ask your audience members who are giving you feedback to describe what they've read in their own words. And that's a way for you to know, was I clear? Do they understand? Do I need to make things clearer for our audience members? You can also ask them to describe what action they're going to take after reading your content. And so again, that goes to the point of, is your material actionable for your audience members? And describing how they would do it. So what are they going to do after they read your material? They may name the action, but what are they going to do and how are they going to do that? You can also ask them to tell you how confident they are that they could do what the content is asking them to do. So these are some items that we pulled from the resource Health Literacy Online, which offers great resources and tips and tools for usability testing and asking your audience members for feedback. So once you've asked your audience members for feedback, you're almost done. Once you've revised accordingly, and if you want, you can ask for feedback again and do a second round of revisions. But from there, you've put in all of the work from considering who your audience is, writing and choosing your words carefully, and doing and asking for feedback and doing revisions. You should be in a very, very great spot. Some tools that I want to share with you that are great assistance for writing materials is the CDC's Clear Communication Index. There are 20 items in there that you can score your material on, and you can also use that as a guide for when you're developing your material. And then the other tool I want to share is the CMS Toolkit for Making Written Material Clear and Effective. I think they have like 8 toolkits in there. It's all got really, really good information for you and guides you through the process of writing effective written materials. So I know that we just covered quite a bit on the process and strategies for creating written materials. Catherine, what questions do we have?
You don't have any questions yet. Everybody, feel free, if you do have questions, please enter those in the Q&A box.
All right. Well, next, I want to address reading levels. As I said before, we do get quite a lot of feedback and questions about what it means for a reading level. So let's talk about that. So reading levels or readability formulas, they analyze your written materials, but they only take into account word length and sentence length. So they're only looking at your words and your sentences and how long those are. But readability is quite a bit more than that. And there are other things that contribute to clarity and effectiveness of your material outside of how well you've written your sentences and your words. Your reader's ability to focus is one factor to consider. Your how familiar your reader or your audience is with your concept. If you present concepts that the reader has heard about before, they'll have an easier time comprehending. The attractiveness of your material also contributes to clarity and effectiveness. So like we said before, is it easy to skim? Are there headings? Are there bullets? Is the print big enough? Is the layout clean, or is it super busy and complicated? Those all make things harder to read too. And finally, does the material have a clear and useful purpose? A clear use and purpose. If the reader needs to take a lot of time to figure out what you're trying to communicate and how to use this written information, they may not engage with it, no matter how low your reading levels are. Also, reading levels aren't quite as precise as we think they may be. The same text can produce different scores depending on which formula you choose. There's always a margin of error that comes with using a readability formula. And the score you get depends on which part of the document you score. If you're not looking at your entire material, maybe you're scoring by hand and using methods like the Fry method or the SMOG index. With those, you're only choosing a certain section of your text. And if you choose one section over another, you may get different results. So for example here, this text comes from a website talking about diabetes and oral health and gum disease. I ran it through 3 readability formulas and got 3 different results. So Flesch-Kincaid formula gave me about 10th grade, the SMOG index gave me about 9th grade, and the Coleman-Liao gave me 11th grade. You can think back to what it was like in 9th, 10th, and 11th grade and what that means and the range that covers. Reading levels are also prone to misinterpretation. They're not as intuitive as we think. And so here, what does it really mean when we say that a material has a readability score of 6th grade? So with all of the reading formulas that are out there, here's what it roughly translates to if you're using a grade level. It means that the words and sentences in the material are roughly the same length as the words and sentences in a textbook for 6th graders. So what it doesn't mean is that people with a 6th grade education can read or understand it. It does not mean that a person with at least 6 years of schooling can read or understand it. So that's important to keep in mind when you're thinking about, when you're considering using a reading formula. Grade level requirements can also potentially be harmful to your written materials. Just the focus is all about creating using shorter words and making your sentences as short as possible. And so what that can lead to, if you're not careful, is that your text is choppy, it doesn't flow, and it makes it harder to read. So let's look at an example. I chose a chunk of text about diabetes and being pregnant with diabetes, and thought to myself, how do I make this a 6th grade or under level? So the first chunk of text here, while any pregnancy complication is concerning, there's good news. Expectant mothers can control gestational diabetes by eating healthy foods, exercising, and if necessary, taking medication. Controlling blood sugar can help you and your baby, can keep you and your baby healthy and prevent a difficult delivery. So to get it to the 6th grade level, here's the revision we did. Pregnancy problems are concerning. One problem is gestational diabetes. You can do something about it. You can eat healthy foods. You can exercise. You can take medicine. You can have a healthy pregnancy. So as you can see and hear, I really wanted to read that out loud to you because you can hear that it sounds much more choppy and a little bit awkward after I've rewritten it to the 6th grade requirement. So where do we go from there when it comes to reading levels? Our recommendations are not to use them to assess overall suitability. If you have to pick a formula to meet a regulation or a rule, pick the formula and method carefully. The Agency for Healthcare Research and Quality recommends scoring by hand using the FRY method, that's F-R-Y, or SMOG, the SMOG index, which stands for Simple Measure of Gobbledygook. If you are going to use a computerized formula and not score by hand, make sure that you prepare your text. Make sure you take away any periods at the ends of abbreviations at the ends of abbreviations. So for example, if you're saying doctor or miss or anything like that, your computerized formula will read that as the end of a sentence instead of an abbreviation. And make sure you are removing any text that's not in full sentences. So your titles, your bullet points, and your headings typically aren't sentences. So make sure you take those out when you're preparing for a computerized reading formula. Other recommendations, if you're going to use reading grade levels, just interpret it more as a general range of difficulty and consider other factors that contribute to making a material easy to read. And finally, it's important to acknowledge the limitations of not only the formula that you've chosen, but also of all of the points we just discussed about the imprecision of reading levels, about what the meaning actually is. Just make sure you acknowledge that. So now that we've talked about reading levels, I will stop here and check in with Catherine to see what questions you have.
Yes, no questions yet, Anna.
Okay. Well, folks, I highly encourage you, if you have any questions, to go ahead and send them our way. So next, we'll go ahead and talk about disseminating your written materials and go through some next steps that you can take for your written materials, as well as some resources you can use. So when you're disseminating your materials, now that you've gone through the process of identifying your audience, choosing your objectives, you've carefully chosen all of your words, you've asked for feedback, and you've made revisions, how are you going to make sure your material reaches the right people? You'll want to consider what format will be best. Should we put it on a website? Should we print it out on a flyer? Yeah, you'll have to think about that. Some suggested channels that we have, your community partners that you already work with, your LHIC members. That's a really great resource too. If you have lots of folks in your LHIC, if there's an email list, that's a great way to disseminate your materials. And if your audience has typically has a gatekeeper, you can go through them if they're trusted members of the group that you want to reach. So some groups that come to mind are potentially some cultural organizations, maybe some religious organizations, faith-based organizations too. In terms of next steps, to take what we've talked about and apply them and go forward, we encourage you to examine and look at a written material from your organization and compare it to how well it follows the techniques that we talked about today. And then taking it one step further, you can choose a material to revise or recreate using the techniques that we talked about today, using those techniques and using maybe even the Clear Communication Index or the CMS toolkit. You can show the before and after to your communications lead or your supervisor and use that to begin a conversation about health literacy and clear communication in your organization. Some resources that I want to share with you all, especially if you're considering the intricacies of what it means to put content, written content on the web. These two sources, Health Literacy Online as well as usability.gov, are really great resources that walk you through some things to consider when you're writing for the internet. And again, I want to emphasize the two tools that we've talked about already, the Clear Communication Index from the CDC, as well as the toolkit for making written material clear and effective from the Centers for Medicare and Medicaid Services. All right, so with that, I want to remind folks of some of our upcoming webinars. All of these occur on Wednesdays, and they start at 3 p.m. sharp. Here is the link to go ahead and sign up for that. Next week, we're going to be diving in and talking about oral communication, speaking so your audience understands. The following week, we'll talk about designing chronic disease programs that address health literacy. So all about program design and making sure you're baking health literacy into that. The following week, we'll talk about creating more engagement with diabetes programs. And then finally, we'll wrap up with diabetes educators and what they need to know about periodontal disease and diabetes.
Okay.
So I want to thank everyone for their time and remind folks that we do have a post-webinar evaluation if you go ahead and complete that after we've wrapped up today. You're welcome to join our email list at this link. If you would like to request the slide deck, the link is there. It's also on the sign up page, and we respond to those within by the end of the week. And you're also more than welcome to contact us by email. So thank you all for attending. I want to open it up again to questions, Catherine.
Yes, we have one question from Suha Ansari. She asks, what are the pros and cons of utilizing social media as a way to disseminate information into the community? And by that, she also wanted to ask, do you advise organizations to utilize these platforms in a way that can increase health literacy?
That's a great question. So in terms of using social media, I think it's, especially in the times that we live in right now where we're very connected to our devices, it's one way to increase the potential reach of your message. You also do have to keep in mind that not everyone may be on social media, so you may have to attack it from a multi-channel perspective. So not only going through social media, but also maybe traditional methods like flyers and like putting things on a website. I understand that maybe on a social media post, you may not be able to elaborate on as much as you would like. So you can always point folks to a website where there's more details, or maybe you can attach a picture of a flyer where there may be more details. Yeah, so I would say yes, social media can be good. Just make sure, again, going back to knowing your audience and testing with them whether they actually use social media and whether you can reach them through social media. Just making sure that that is an option and that is a way to effectively reach who you're trying to reach. And then keeping in mind also this notion that folks may not have access to social media the way that we assume. So those are things to keep in mind, making sure that you keep your audience and their needs and challenges and barriers in mind.
Okay, that's all the questions that we have.
Oh, okay. Well, thank you all for attending. We really appreciate your time, and we look forward to seeing you at next week's webinar.
Okay, do you want me to stop the recording? I can stop it.
Yeah.
Stop.